Hello, welcome to First Aid Basics. My name is Erin Smithers. I'm with the Arc of New Jersey, and you have my phone number and my email. And let's get started. So what is first aid? First aid is help given to a sick or injured person until full medical treatment is available. Can anyone do first aid? First aid is about helping as soon as an incident happens. Whether it's calling 911, getting a Band-Aid, or just remaining calm and talking someone through their emergency, that can be first aid. So anybody can do first aid. So what exactly do you do in an emergency? Well, we're going to go over different types of emergencies and different situations so you can better be equipped in how to handle each one. The first one we're going to touch on is bruises or scrapes. You've probably seen this in your lifetime, or you've probably done this to yourself in your lifetime, so this is fairly common. So if someone bruises or scrapes themselves, or if it's you, you want to call for help, you want to get someone who is around to help you out, either a coworker, a staff member, just someone who else can help. So you want to clean the area. In this image, the scrape is on this little kid's knee. So you would want to clean the area, make sure you're using water, you're being gentle, you don't want to make it any worse than it is. Then bandage the area and go through head to toe and see if anything else is hurt on that person. Make sure that they can wiggle their fingers, they can move their feet, but you don't want them to get up in case it's more severe than you think it is. So whatever position they're in, try to help them in that position while you get help, while you try to calm them down, while you clean the area. The next situation we'll talk about are bee stings. This can also be fairly common, but you have to be very careful as some people are very allergic. So the first thing you want to do is, again, get help. Get someone else involved. If the person seems to really be struggling, maybe call 911. Once you have help, you want to remove the stinger. You can do this either with tweezers. Some people use a credit card and scrape the area, and that will help get the stinger out. Once the stinger is removed, check on the person. Make sure that they're doing okay. You'll see if someone is allergic, they're going to have trouble breathing. They might even get a little swollen. If they are allergic, ask for their EpiPen. They usually will have it on them. You don't want to use someone else's EpiPen on them. If someone is allergic, they're usually carrying around their own EpiPen. You can follow the instructions on the EpiPen, but you want to take off the lid and you want to kind of jab it into their leg, and that's going to help release the medicine to help subside their allergic reaction and possibly help them breathe. It is very important that if this happens, if someone is allergic and having a reaction, you want to call 911. You want to call 911 as fast as you can. So once you've gotten the stinger out, you want to clean the area, and then you can bandage it either with a Band-Aid or some form of wrap, just something to keep it clean and sterile. And along the same lines, we're going to talk about tick bites. If you live in New Jersey with us, walking through the woods, walking out on the street, you're bound to have a tick on you. Certain ticks matter as far as getting Lyme disease or having a reaction, but most of the time, the majority of the ticks that fall on you are not going to get you sick. You just want to keep an eye on the area. So again, the first thing you're going to do is get help. You always want to try to have someone else involved. That way, if more than one function needs to be done, you have multiple people that can help you. So get help. You want to use tweezers to remove the tick, but sometimes the head will stay in the skin, so you want to make sure you're removing the whole tick, especially the head, because it can regrow its body. Make sure you're getting the tick out. Then you want to clean the area. You can save the tick to show your doctor, and you want to watch the area to see how your body reacts. If you start to get kind of a bullseye ring around the tick bite, you definitely want to go to the doctor. It would be good to have the tick with you when you do that. So just stick the tick in a Ziploc bag or a napkin, and you can bring it to the doctor with you. If you do start to get a bullseye mark around your body, don't worry. Medicine has come a long way and can help you if you do wind up getting Lyme disease or having some sort of reaction. The most important thing also is just to try to stay calm. And this staying calm is going to help you if you come across someone who has a deep cut or a laceration, which is a very deep cut. So again, you want to stay calm. You want to help the person stay calm, and you want to call 911. If you ever see blood, you want to call 911. You want to get help. You want to have someone else involved. Do not move the person. You want to make sure that you're not making the situation worse. Sometimes moving the area can make the cut deeper or it can make it longer. So just keep the person still, keep them calm. Try to clean and close the wound. So this means try to, if there's any debris or rocks or dirt, try to clean it gently. Again, you don't want to be too rough, but just try to clean out all that dirt. Try to make it as clean as possible without making it worse. And then to close the wound, you can use a bandage. You can use a Band-Aid if it's not that large. And then just wrap the injury in gauze to try to keep it closed and to keep pressure on it. And then you just want to apply more pressure to stop bleeding. So once it's cleaned and once it's bandaged, you can use your hand to apply pressure to help stop the bleeding until either more help comes or 911 comes. The next situation is dizziness or fainting. If you're near someone who seems to be getting dizzy, have them sit down and then call 911. You want to call 911 if someone faints or if they feel like they can't stand on their own. Call for help. Have someone else come help you. You might not be able to hold this person's weight all on your own, so getting someone else to help hold them or keep them calm is always going to be beneficial. Talk to the person. You want to keep them alert. So if they're just dizzy and they're still conscious, you want to talk to them, ask them questions they would know the answer to, like their name or where are they, what year it is. Just simple questions that will keep them alert and keep their brain moving. This will help keep them conscious and focused. If they do faint or pass out, try to keep them comfortable and try not to move them until help arrives. Now, if someone you know or someone near you is having chest pain or possibly suffering from a heart attack, you want to stay calm and you want to call 911 as fast as possible. Whether it's chest pain, whether it's acid reflux, whether it's a heart attack, either way, the most important thing is to call 911 to get help there as fast as possible. Even if it's not severe, you could be saving their life. So again, you want to help them stay calm. You want to maybe ask them questions to get them focused on you instead of their pain or their anxiety that they might be having because of this pain. Some of the symptoms to look out for are a tightness in your chest, a pain in your chest, or a pain going down your arm, pain in your back and in your neck, and if you kind of feel constricted. If you have trouble breathing, this could also be a symptom. And then also if someone starts to feel it's hard for them to focus or it's hard for them to concentrate, that could also be another symptom. So just stay calm, help them stay calm, talk to them about other things that are going on in their life. Maybe ask them, how their home life is doing, ask them how work is going, try to get their mind off of the situation they're in. Call 911 as soon as possible to get help there, and just make sure that they are breathing. If they stop breathing, you definitely want to let the 911 operator know, or the person that is there helping you, let them know, because then you want to move on to CPR. So the most important thing to do in any emergency is to call 911. If you think it's not major, but it could be, call 911. If it's definitely major, call 911. Don't assume someone else is going to call 911. Take on that responsibility, because a lot of times other people will assume that you're calling 911 or that they're calling 911, and in reality, no one is calling. So if you happen to come across a scene, take charge and get help. Either call 911 or tell someone else to call 911 by pointing at them and using their name. This is going to assign the responsibility to someone and ensure that at least one person is calling 911. If more than one person calls, that is quite all right, because the 911 operator will know what's going on and will let them know. But it's just important that at least one person calls. And this should always be the first thing that you do. So when you are alone or when you are going to go on a trip, it's always important to have your own first aid kit handy. You can do that by buying pre-made first aid kits in the store. They can be a little expensive, or you can make your own and include what items you think you'll need for the situation. So if you're hiking, you can make sure to include something for bee stings or insect bites or skin care like sunblock. But a regular first aid kit will include Band-Aids, alcohol pads, rubber gloves, gauze, tweezers, crepe bandages, safety pins, that's going to help close the gauze or the bandage, itch relief wipes, like we talked about for insect bites or for burns, antiseptic cream, sticky tape, antihistamine, a thermometer, ibuprofen or aspirin, and a list of emergency numbers. This could include poison control, obviously 911. It could also include a local non-emergency police number. Anything that you think is going to help you in any sort of emergency, because when you are in an emergency, you might not think to look up these numbers, or it could cost you time to stop and look up these numbers or get these helpful tools in your first aid kit. Having them readily available could save precious minutes when you don't really have that much time to help someone. It's also very important that you make sure your first aid kit is always up to date and fully stocked. So you might go in and use Band-Aids once in a while or use the gloves, but it's very important to make sure you're replenishing that in case you do need them for an emergency. You also want to make sure that there's certain things that have expiration dates, like maybe some Neosporin, or even if your Band-Aids are too old, they might not hold that stick. So it's important to make sure that your first aid kit is fully stocked and up to date. I am not able to do CPR training, but if you are interested in learning how to do CPR and rescue breaths, please look into classes that are held all over the state. The Red Cross offers classes, and then a lot of the programs that we work with also offer classes. So if you are interested in learning more about CPR or learning more about what to do in an emergency, you can search online for classes that are available to you. It will list when and where they are. Some classes cost money, some don't. It's all just about what classes are available to you in the location that you're at. So also, if you have any questions about this training, please give me a call or shoot me an email. Hopefully I'll be able to answer those questions. If not, I will point you on to someone who can. And I hope this training helped you feel a little bit more confident and comfortable in helping someone else in an emergency. Thank you.